Hello dear students, today we will study the cardiovascular accidents. But before we start, please prepare the following materials and follow these instructions. At the end of this video, you will be able to explain the cause of myocardial infarction, list the symptoms of myocardial infarction, list the factors that can cause infarction, and propose some attitudes to avoid infarction. In the previous videos, you learned about the structure of the heart that consists of four chambers, the auricles and ventricles, and the two types of blood vessels, the arteries and veins. You learned also about the cardiac cycle and the phases that make this cycle. You learned about the auricular systole, the ventricular systole, and the general diastole. And we learned also about the double circulation of blood that includes the systemic and pulmonary circulation. But what would happen if the beating heart stops acting the way it is supposed to? And this line straightens for a while. Pause the video and think about the consequences. In fact, many factors can lead to stop the normal pumping of blood by the heart. Here we talk about the cardiovascular accidents. Cardio refers to the heart and vascular refers to the blood vessels. The cardiovascular accidents is a term describing a range of conditions that affect the heart and blood vessels. As an example about cardiovascular diseases, we will talk about the myocardial infarction. And as we mentioned before, myo refers to muscles and cardial refers to heart. So as a definition, the infarction of the heart or myocardial infarction is a cardiac accident that results from a poor blood supply of the cardiac muscle. But who is responsible for supplying the heart with its needs? Uh, who transport the oxygen gas and nutrients to this muscle? Sure, it's the coronary artery that is a blood vessel that supplies the heart with its needs as an organ, means nutrients and oxygen gas. So, as a result, if we have a problem at the level of coronary artery, it will lead to a poor blood supply of the heart, and this will cause an infarction of the heart, or what do we call a myocardial infarction. But what is the cause of this problem? What does prevent the passage of blood through the coronary artery to reach the heart? To answer this question, I want to show you this image and tell me what are the types of food present in this image. Mainly it's lipids. We have food rich in fats and cholesterol. You should know, dear students, that a big amount of these substances cannot be transported easily by the blood. So the consumption of a big amount of this type of food is a reason that can be responsible for the blockage of passage of blood through the coronary artery. To more understand what's happened, let's examine the coronary artery for two persons. The first one has a diet poor in fats and cholesterol. The second person has a diet rich in fats and cholesterol. Let's learn how the myocardial infarction happens. This is the cross-section of coronary artery of healthy person. You can see that the wall is clear without any deposit, and the diameter of this artery is normal. While here we have a section that refers to the coronary artery of a person that has a diet rich in cholesterol and fats. You can see the accumulation of fats and the cholesterol on the wall, you can remark that the diameter of the artery decreases. Here I should mention that this deposit of fats and cholesterol is called plaque. Now I want you to pause the video and try to compare the aspect of these two arteries and their diameters. So the wall of healthy artery is clean, while in the artery of the individual with a diet rich in fat, it is covered with the yellow deposit. The diameter of the opening of healthy artery is greater than that in the artery of the individual with a diet rich in fats. And pay attention that when the diameter of the opening decreases, we have a difficult passage of blood. And when the quantity of fats and cholesterol increases, the size of the deposits increases, forming a plaque and prevent the passage of blood. And as a result, we have formation of a blood clot. This is the blood clot. It's a small mass of coagulated blood. Let's list the steps of occurring of myocardial infarction. In the first step, we have a normal flow of blood inside the coronary artery. Then the fat deposits and cholesterol, called plaque as we already mentioned, can build up on the wall of coronary artery, narrowing the opening inside it. The size of the plaque increases as the diet becomes richer with fat and cholesterol. And as we said, the fat and cholesterol constitute the plaque. Then the diameter of blood vessels decreases and a small mass of coagulated blood is formed. This is the clot. We have here the blood clot that is formed as the fatty deposit, and it blocks the artery to reduce or stop the flow of blood. The area that is usually supplied by this blocked artery turns into a deprived area that lacks oxygen and nutrients, leading to myocardial infarction. If someone has some symptoms, we will discuss later these symptoms, the doctor asks the patient to make a specific examination by a technique called angiography. It's a technique of visualization of blood vessels, and at the end of this technique, we will obtain this document. This is an angiography of healthy person, and this is an angiography of uh, an individual that has a problem at the level of coronary artery. This angiography shows a narrowed artery. A narrowed artery means that the artery is not wide, its diameter is reduced. Here, another schematic representation of the arteries. You can see here the narrows because of the presence of blood clot. Now, dear students, I want you to pause the video and try to explain the occurrence of myocardial infarction based on the information already explained. Here we have a schematic interpretation of an angiogram showing a narrowed artery. So we start. The myocardium, the muscle of the heart, is supplied by nutrients and oxygen gas by the coronary artery. We have accumulation of fats and cholesterol in the coronary artery. Fats and cholesterol form a plaque. The plaque narrows the coronary artery and leads to the formation of blood clots that prevents the passage of blood transporting nutrients and oxygen gas. The area that is irrigated by the coronary artery will be deprived from its needs, stop contracting, and eventually dies. So, all these steps will cause the myocardial infarction. Now we want to make a short application. The adjacent figure shows a cross-section of an artery after a cardiac accident that results from a poor blood supply of the cardiac muscle. Give the name of the cardiac accident described in the above text. It's the myocardial infarction. Indicate the name of the structure X. Sure, it's the plaque. It's a yellow deposit, so it is the plaque. What are the two main constituents of the structure X? So, as we already said, the plaque is formed of fats, deposits, and cholesterol. What do we call a small mass of coagulated blood? It's the blood clot. And now, what are the symptoms of an infarction? We have arm and neck pain, chest pain, nausea, shortness of breath, fatigue and sleep disturbance, headache, and anxiety. And what are the causes that lead to a myocardial infarction? A high blood pressure, smoking, eating food rich in cholesterol and fat, stress, heredity, obesity, diabetes, and inactive lifestyle. At the end, we will propose some attitude to avoid myocardial infarction. You should make healthy food choices, maintain a healthy weight, stay active and make sport, don't smoke, monitor your blood pressure, eat food low in fat and cholesterol, and control your blood sugar. And this is the summary of this lesson. These are the causes of myocardial infarction, the consequences, and the results. Don't forget to write this summary on your copybook and study well. Stay safe, dear students. Goodbye.